Welcome to Cups and Courage. Today's guest is Charlayne. Charlayne is a clinical nurse specialist or a breast cancer nurse, and she also is co-founder of a charity called Aurora, which specialises in breast cancer well-being for young women. Cups and Courage, the podcast. Hello.
Hi.
Welcome, Charlayne. Thank you so much for being here.
Thank you for having me.
I'm super excited about this conversation because I know the perspective that you are going to bring into this is going to be really unique for us and also so valuable for anyone listening to it. So thank you for giving up your time. The most important thing, so we always ask our guests to bring in a biscuit of choice.
Okay.
And I don't know it. I don't know what it is. So here we go. Oh, I mean this when I say this. These might be my favourite biscuits. I'm not even lying.
No.
I mean,
very decadent, aren't they?
Yes, they are. And I love a biscuit. They are because there's a lot of chocolate in them.
They've got smaller, haven't they? That's the thing I've noticed.
They have.
But still, I'm sure just as delicious.
Everything's got smaller, hasn't it? More expensive. But these I love these. Sometimes I have to put them here because then we're talking and it gets noisy. But actually, I'm not sure I can have that looking at me for the next.
Nor me. We'll see how long it stays there.
Right, I'm going to place it back here. Thank you. Any reason for your foxes?
Well, I love all biscuits. And last evening, I popped out into the supermarket, into the biscuit aisle. I thought, what do I choose? Then when I saw these, it just brought back a nice memory of Christmas time. You know that time where before Christmas, you're starting to look around and just choose some nice luxury things to put away for Christmas. And I can remember my mum saying to us, do not touch those. Those are for Christmas. And just that moment when the Christmas comes and we munch into these, and it just reminded me of that. And my parents aren't here now. It was just like a nice memory that we shared.
I love that. And I think it's the luxuriousness of these.
It's such a treat.
Yeah, so brilliant. Thank you. Okay, so another tradition that we have is we always start light and we say, give us your definition of courage.
Yes, there's so many acts of courage all around us, and also for what I feel for myself. And when I thought about it, I came to the conclusion that it's about being courageous enough to be vulnerable, courageous enough to be able to expose yourself a little bit. When I ask somebody, how are you? So many people want to tell everybody or to give that impression they're all coping well, but really, often they're not. And if they are courageous enough to open up, to say, this is nothing like how I normally feel. I'm normally a person that copes really well with everything. I'm high functioning. I manage all of these things. And this for me feeling is so unfamiliar and I don't like it. But to be able to think it's okay because everybody feels the same. I think with social media now, everything looks perfect and everybody's trying to be perfect. But if you can open up with vulnerability, you just get different layers of conversation and so much more quality conversations, with patients, friends, colleagues, everybody really.
Thank you. And I think that is that interconnection with the vulnerability. Being courageous enough to be honest in that vulnerability.
It is. It really, really is.
And actually, it's interesting because when you're saying almost what you're hearing is, I'm doing well. I usually high function. I usually, I'm going, I think I said those things. I think when I was out, I think it's a reflection, isn't it?
It is. And often people will say, well, I'm not going to get upset about it. All I want is a plan. I've got this. And you think, that's fine, absolutely. But as time goes by, just trying to cope like that, day in, day out, you just get war weary of just trying to cope and put on this brave and coping kind of facade, really, sometimes, isn't it?
Absolutely. And mechanism, I suppose.
And
it's
mechanism
just, keeps you...
Also, yes, absolutely. To yourself, that it's okay, I've got this, I'm okay. Yeah.
If I say it enough...
I'll think it and I'll feel it. Absolutely,
Okay. Thank you. Okay, so Charlayne, can you give us a little bit of an introduction to who you are and the role you play within the breast cancer world?
Okay, so I started my career over 40 years ago and I've worked in all manner of areas of nursing. And then I worked on a mixed surgical ward where I looked after women having breast surgery. And at that time, the most common type of reconstruction was an LD flap, that's a dorso flap, which was kind of big operation with quite a long stay. So you got to know the women well, and you feel you sort of created a relationship with them. And as time went by, when they left, you never saw them again until I met them maybe in the corridor in the hospital. And maybe they're going through chemotherapy and they'd lost their hair and they looked so different. And I just felt I didn't really know what to say or how to help them. And it really made me reflect on that I would like to be able to have that ongoing relationship with somebody and to actually specialise, and rather than being medium everything, a jack of all trades, that I could really choose something to specialise in and hopefully be able to build that and make a difference. And it's been the most amazing thing to do. It really is such a privilege to do it.
So you are a breast care nurse, is that
I am a breast specialist nurse, yes.
Breast specialist,
yeah.
Thank you.
And I did my training in 2007, so a good while ago now. And at that time, my children were in senior school, and now I've got 3 children growing up and 5 grandchildren. So my girls are in their 30s, just 40, and my son. So I feel that I'm with children and with young people, all ages, and I think that's good. It keeps that perspective.
Yeah,
I think
absolutely.
it's really good.
Absolutely. So you trained in 2007 in breast specialty?
Yeah, my breast specialty, yeah.
I mean, I can't, quick maths here. It's just under 20 years. So this might be a tricky question, but what's changed within the...
Such a lot has changed.
Okay.
In a good way.
Yeah,
I think, actually. When I first started in the hospital that I worked in, we had a chemotherapy team. We didn't have a breast care nurse per se. I did my training and then started to go into clinic. And I started meeting women and they would say to me, "You're a breast care nurse?" Oh, and they wanted to talk. And I had this after virtually every appointment. And I remember thinking to myself, there are so many women that have been going through this. And how will I reach everybody? And so that's when I decided to set up a little support group within a hospital and bring everybody together and start delivering information. That's how things started in that way. There wasn't all the availability of information. It wasn't so easy to seek it out. So I think the availability of information now is so much more than it was then. It was quite closed and it was difficult to find people with information, but now there's a lot out there. I think we've now trained much more on advanced communication and we're understanding more holistically, but having the impact of cancer and the treatments, but also when the treatment's finished, what happens next? When a bomb goes off in your life, we treat that, but we need to bring it back somehow to a form of glory or place where it's comfortable, and that is a journey in itself, isn't it?
I trust, so if we're talking like nationally, how much, is that quite a consistent approach, now across the UK? Because so if I think about my own experience, so I had a very positive experience with breast care nurses, and absolutely they were I'll get emotional when I talk about it, but absolute angels in my journey, and filled the gaps that I felt were missing in different areas. But I know definitely where, at the point when things were over, or like there were stops and I was moved into kind of open access. It was very much, everything is open for me to be able to reach to side. I can call and everyone is very, caring on the other side of it. But actually there were no interventions or anything. Afterwards. I had to, and I still have to, and that's okay. But I wonder, is that, because you're talking about the after approach and care after the bomb's gone off.
Yeah. I remember when open access follow-up was being designed. And the main design was, at that point of time, there were women in clinics that were healthy women that still felt as patients, but they were coming for regular checkups, and the appointments would be full of mostly well women. And so when a woman had a problem and she called, there was no clinic spaces to see them. So they felt that by using the open access follow-up process, that would allow anybody that really needs to be seen quickly.
Yes.
And it kind of made sense to do that. But of course, the open access follow-up appointment, which was kind of bringing things together, making sure that all the follow-up, like mammograms and checks, were in place, demonstrating to women how they can self-examine themselves and when to come if there was a problem, what to recognise, and then it was a little bit off you go.
Yeah.
But I think now what there is more now, Macmillan have been very helpful. There's lots of follow-up programmes. It's mostly charities now that are doing the holistic side.
Yes.
I think the hospital base is around the treatment, delivering that, and then the holistic side really is what is voluntary out there.
And what are your thoughts about that?
I'm so pleased that those structures are in place. The reality is, how does the NHS manage to follow that whole journey so that people come through it safely and secure it and come to a place where they feel safe and comfortable with some sense of new normality? It's a difficult thing. There are more charities coming into hospitals and delivering programs, which I think is helpful because it's within that hospital kind of setting and people come in, it's bringing expertise together. I think that's a very positive thing. But I think it's difficult, even moving forward now with the constraints, how we would make it more holistic under the NHS. We are very reliant on the charities to do this.
I hear that, and I understand, you know, because actually the role of the breast care nurse, you know, from a holistic point of view, I mean, it's huge, and it's actually not the same for everybody, because one person is going to be different, and for you to be able to meet the needs of those people, it's, you know, I think it's a tall order, so it's absolutely essential that there's a buffer within those charities. But
when I go back to that time when I very first started, and that developed into a charity where there was some nice face-to-face. There was coffee mornings, coffee chats. Then we set up some pamper sessions so people could have some complementary therapies. And I did that for quite a while. That worked really well. And I had a committee, became a registered charity, and that now runs itself. But what I've noticed in terms of change over time is more young women with breast cancer. And I think that brings another whole set of challenges. And younger women used to say to me when they went to the support group, they would walk into a room and sometimes they would say, "Oh, I think you're in the wrong place." I said, "Well, no, I'm not. I've come to the breast care support group." And I think that some women then didn't want to attend because they just hadn't found their tribe. They felt more alone because they were young with different challenges.
Can't see anybody that looks like them.
Nobody that looks like them.
Yeah.
And so I worked with a female surgeon, and we got chatting about this and what we could do. Because we used to have a consultation with a person and it would be devastating, and they would walk out of the room and we'd look at each other and think, "Oh, it's heartbreaking. You know, they're going to just walk out now. How are they going to get that care?" So we then built a young women's charity now, which has been going now for 10 years, which has been incredible. And I think the women there benefit so much that we can really tailor-make that and make that bespoke programme for them. So in our local area, that's really important. We don't have any of the national charities where we are. There's no Maggie Centre, there's no Penny Braun, there's no Haven. So we were just quite a silo on our own without any of those supports. So we've had to build it for ourselves in our place.
Wow.
Yeah,
that's an amazing thing to be able to do.
Oh, it's been an incredible experience.
Yeah, and to know that something from the ground, you know, a gap. You found a gap.
Just that gap right there, and we meet those women.
Yes.
So we have the health professionals around us that can see them and signpost them. So they're not reliant on the social media or any platform to find it. Yeah. Hopefully the others will as well. But we can actually see them, meet them, talk to them about it, and they can come.
It's such a hard thing to navigate. I think in my head, different people need different things, you know, and I desperately didn't want to find a group of people at that point in my life, you know, and that changes absolutely, because I think different things evolve, you know, as you go through different phases of recovery or your journey. But some people will really benefit from what they get from that wider group face-to-face interaction, and some people will one-to-one.
Absolutely. I think some do, and I think at that point, there's so much information to take in. you're just trying to cope yourself,
Yes.
aren't you? And talk to your nearest and dearest. And it may not be something they would pick up at that point of time. But I think once they know about it, then I think that's something that's there. And I think when you're going through the treatment, you're just trudging through that treacle, just taking a step at a time, getting through. But when you come to the other end, and if you get to finish your hospital-based treatments, that's the kind of time when you look over your shoulder and think, on earth have I just been through?
Yes.
And people around you think, well, it's all finished now, and you're cured, you should be absolutely fine. And then you go on feeling not fine or not yourself, and you can't find that sense of normality. I think sometimes having other women to talk to that get it can be helpful. But we haven't based everything around talking. From listening to what all the women tell us, we've built retreat weekends, which is restorative. So we have sort of yoga, nutrition, talks on sexuality, body image. And so sometimes people just come and listen. Some people chat. It's just a safe space to be in. It's so valuable, isn't it, to be in a safe place like that where people just get it.
And and safe to be vulnerable. Talking about those things,
that is
the big changes, you know, how it impacts relationships, you know, how it impacts your thoughts and feelings about who you are and how you feel.
Yeah.
To sometimes people just need to be asked the right questions, and you know, to be able to.
They do.
In those spaces.
Yeah, and I think if you looked at it in a more of a consultant setting or an appointment setting, to start to ask about something intimate, it's so hard. It doesn't always feel the right place, and so sometimes doesn't get spoken about. But I think if we can put it in a safe space and have somebody talk and facilitate, and then we allow the ladies to go off and chat and have coffee, and it just opens the topic of sharing, just knowing you're just not alone.
Yeah. And going back to what you were saying around, you know, people sometimes are, I'm fine, I'm coping, I'm doing. And actually, if those are masks that people wear, sometimes it takes a moment for us to feel safe enough to drop those masks. So actually just taking someone out and creating a different environment for them and putting them in a safe space around people that, no judgment, not on a time limit. No. We don't feel like we're taking up too much time by talking about something or blowing something out of proportion. I can imagine that's so beneficial for people.
I think the recovery is such a huge part. And I think when I work with the surgeon who is a real advocate of teaching, you know, she's amazing at teaching, she teaches internationally. And I think her thought was, let's get information. What do they need to know? It's all about information giving. And gradually as we went by, we've done less and less and less and much more about restoration. And I think that is really played into her practice and the practice of our colleagues, because they're actually hearing what happens outside of that consulting room and what the real reality is. And to be able to bring that in to our appointments and our consultation has been invaluable, I think.
And revolutionary.
It is revolutionary. It really
because you're
is.
going from thinking to feeling, right? So we can only give so much information, we can only also absorb so much information. And as long as we've got clear access to that, which you know, breast care nurses do that in spades. There's, you know, there's information there now. But you're right, that restorative kind of space feeling to be able to integrate that into everything. And
I think when our surgeons hear, when women say, I sat in that appointment, I listened to everything you said, and I nodded, and I said, absolutely fine, you know, I've got that, and I walked outside the room, that's what they think has truly happened. But then when they hear back, I sat in there, I never heard a word, I nodded at everything, all I could hear was the C word, and everything else went out the window. And you could see them thinking, crikey, we thought we knew what we saw, but that isn't really the reality. And in fact, someone I spoke to earlier this week came with her husband, and they listened to a lot of information coming out. Right, yes, I understand that. Thank you, brilliant, I've got that. And they left. And when I spoke to them on the phone, they said to me, it was great to have all the information, but it was like drinking through a water cannon. And I thought, gosh, I think they heard it, but it's gushing at you, isn't it? And you're having to just absorb all of that. And then I think what the breast care nurses play a role in is afterwards having that conversation again. When they say that to you, have the opportunity then to just take it slowly and to go back through everything, and they're starting to assimilate that conversation. More questions come out of that conversation. So I think the role of the breast care nurse is being in that consultation, know what's being said, know what the conversation is, also being able to watch the body language, and if they look puzzled, to maybe stop and say, do you want to take a break? Does that sound clear? Do you want to go over that again? Maybe intercept and ask a question on their behalf. So it's very integrated like that. And then the follow-up is following up from that afterwards.
There's a very high level of emotional intelligence needed. How does that impact you as a human, you know? And I mean you and you collectively, you know, as well. But like, that's a very in tune situation, and that you've got to be aware emotionally, but not be porous, because otherwise you can't do it day in day out.
No, you cannot.
So, how does that impact you? First one, and then I suppose what mechanisms do. You know, as an individual, have you found that work for you?
Yeah, I've got mechanisms. I think, firstly, compassion, compassion is there. And I think compassion is, if I was sat there, how would I feel? Or know my loved ones. And I don't think you ever lose that. And that's the most key thing, to actually feel that connection of what that person could be feeling or masking or behaving. But also, how I kind of see it is, I know that there's a lot of emotion going on. I know that they've got, hopefully, family and friends. There's a lot of emotion. And I feel that for most women, they don't want a cup of tea and a cuddle. What they want is, get me a plan. Let's get control of the situation. What happens next? So I see mine as actually getting that plan together, making it happen, getting dates in the diary for them to be able to start to feel, right, we know where we're going, this is what's happening next. So I put a lot of energy into listening to what they need. Some people need space and time to make decisions. And I often ask, are you a type of person that likes lots of information so you can make an informed choice? Or you're more of a person that would rather leave it to recommendation to your medical team? So I get a bit of a gist of where people are coming from.
Do people know if you ask that question? Yeah. Does someone tend to be able to answer that?
Sometimes people say, tell me everything.
Yeah.
I need to know everything.
Right,
I work in an area. I need all the details. I'm planning 2 years in advance in my job.
Yeah.
I can't do that, but we can do the nearest part. And other people say, I find this whole thing just overwhelming. I don't know.
Yes.
And I want you to be able to say to me, what should I do? And I think choices are quite difficult because sometimes there's not a right and a wrong.
Absolutely.
And we say you can do this choice, that choice, that choice. And that can be very difficult. And so the thing I would always say is, we don't need to rush at this. The cancer's been there for a while. A week or 2 or 3, and the scheme of things is not going to make any difference. Let's just take it a step at a time and give them time to be able to think about that. And not just the physical side, because often women really commonly say, just take my breasts off. I just want this done. And it's just understanding that the breasts aren't a threat to your life. It's what goes out into the body. And I don't think people ever think about that. They just think, all the cancer is in my breast and that's what I need to get rid of.
Yes.
And it's getting past that whole fear of take everything away. If that's going to make sure that I'm going to live, a long life to be there for my family and for myself. So it's slowing those things down, helping that understanding there.
And how do you feel at the end of the day?
Yeah.
So let's say you've had, I know that you guys will see, we know increasing rates of people, that are diagnosed with breast cancer anyway. So I don't know how many people you might see in any one clinic.
Quite a lot.
Right. So what's the impact at the end of the day?
I think that I think about, I need to give the person what they need from us. That's important. There's lots of emotion. There's no point me getting emotional because then I'm alongside. I need to be able to do that. So I'm quite practical with it, but highly compassionate. And I think if I could feel too much, I wouldn't be able to cope and see the next person.
Yes.
I have this little division of something that I do, and my colleagues laugh when I do it. But each time I say, hold on, I've got in my pocket, I have one little aromatherapy little rolls. So I have a little bit of, I have a little bit of hand cream, put my lip gloss on. And then I feel I've just done a little bit of self-care. I'm going to separate that appointment so I can go in fresh again and have fresh ears, you know, to listen and again. And so people laugh, here it comes, she's getting out of hand cream. But then people often say, oh, it smells lovely in here. It's all the aromatherapy. Charlayne's around. I know where you've been.
Yeah.
But I find that's a little bit of self-care. And it's a little small thing, but I find that really helps.
It's also a transition, isn't it?
Yeah.
A lot of cultures have that in terms of changing from room to room. Or so I think there's probably real science behind that as well in terms of the benefit. But as you say, if you're able to go, okay, let me just pause, take a moment, do my thing, and now I can move over.
Yeah.
And not carry that in. And it's not this fluid kind of...
No, it's that separation.
I can imagine it would just accumulate otherwise. Yeah. And then you'd go home and
just be kind of overwhelmed.
Yeah.
And sometimes we do it up in the office when we go back upstairs and we have a little bit of a debrief together. Sometimes I say, let's get our spritz. So we have a few little deep breaths, have a little shake. And I think you just have to find your own little kind of strategies of that, don't you? One of my colleagues, she'll often say, do you mind if I just go for a walk? And she'll pop out, get a little bit of fresh air, and then cut and come back. You've got to, because if you don't look after yourself, you can't look after others. And you just have to make sure that you just allow that bit of time to do that. And when I go home, it's a similar thing. I'm going upstairs for a bath. And I'll just go up there and just have a bit of time out.
Just decompress.
And decompress,
the
day.
Okay, thank you. Because I've always thought this, I've been in lots of waiting rooms, as we all have, and I've been on lots of different sides of it, going in for seemingly nothing, coming out with the world crashing down, but also, coming out and it being good news and having everyone around me and not good news, right? And in those spaces, those environments, you're going to have a multitude of energies and feelings and emotions and going on at any one time. And I always think, the consistent people that you see, like you've got breast care nurses and you're in that space day in, day out. And I know that we have to just build up that almost, I say resilience, but it's not. It's those mechanisms that allow us to still thrive and do a really great job and know we matter, Yeah,
and I think another part of it is you could see some people in just their darkest, most frightened moments. But then we normally have the confidence that once we get through the treatments and you come out the other side and you start to see the person that they are, because when they first arrive, they're scared. And so that's the person that you meet. And then they're going through treatment. And it's lovely when you do get to see them for your follow-ups and your holistic assessments. You come in and you think, wow, you look different. Your eyes are light, and we have a hug and we have a chat. And I think it's knowing at that first point that you get through it just step by step. And when you come to the other side, it is joyous to see people come through, and most women do come through in all different sorts of formats. And that's a different part of it. But there's sort of laughter and joy and sadness and grief and relief. There's all of those things in the appointments that we have.
Yeah, absolutely. What's a challenging part of your job, apart from the emotional impact in terms of the difficulty and the toll that I can imagine it would take in terms of that world, but are there any really challenging parts for you?
I think sometimes when you're trying to advocate for somebody and you know what they really want, and you know that you're listening and you want to make sure that the surgical team and the decision makers, our MDT, that we're listening to that. And I think it's hard when we can't always give people what I think they're seeking. But sometimes I think that as you go further down the line, there's more time for reflection. For example, if women want to remove a healthy breast for all sorts of manner of reasons, and that feeling it's my body, I should be able to decide, when we know there's a lot of guidance and mechanisms around that, that can be difficult, or just not being able to give enough of what women want and not enough time. Yeah, that's a big thing, actually. Just being able to give what you think that everybody needs, that is a big challenge.
And what people need in the moment versus what they need 15 minutes later when they've had a reflection.
Yeah.
You know? I get that. So I think there is an interesting piece here. So I had a double mastectomy and I stayed flat, but I had multifocal lots on one side, and then I had a large chunk of DCIS on the other, but I also had a gene mutation, so we took everything off. But there was a point where we didn't know if that was DCIS or something else. Yeah. So the decision was absolutely we're only taking one. You know, up until 2 days before my surgery, it was only one, and I don't know how many times I've got to have the other one up, you know, I've got to. And actually my breast diagnosis absolutely, it felt like they were with me. Yeah. You know, it absolutely did. And I think that must be such a hard line to be in, to make sure that you've got the patient's back and they know you've got their back. But actually the outcome, you can't necessarily influence the outcome from a medical standpoint, because if there are reasons as to why, you know, that can't happen or whatever, it's knowing how much to push, and also then knowing that surgical team in place and you know, any bias that might exist, because humans exist in all different situations. And so regardless of the role we play, we might find people that we don't agree with, or their style of working actually is like, oh, this is quite challenging, and how do I maintain professional, how do I maintain all of these things? But if there's other things in there that what, Gun, you had a thought then.
Do you know what? I think we're just asking that question, what do you feel challenging? And sometimes I think I don't even give myself time to think about what I think is challenging. And I think that kind of just took me for a moment, because I think I'm not sure. I think I just take it as it comes. There isn't a major thing. I think funding is difficult, and
I think I like asking questions.
Yeah, please
so
do.
It's curious.
Yeah.
And actually it's okay if we don't necessarily find anything challenging, or the things we find challenging are out of our control. Yeah. And therefore we accept them, and we just learn to work with them rather than take it on as a challenge. I hear that actually in an ideal world, giving people more time, right, is you know, as a human, you want to meet the needs of each other, right? You don't want to have to cut something short because you've got somebody coming in, you know. So I can hear that's a challenge. And then actually probably in any situation where it's high emotions, you're going to get different sides of people. And actually what you say, you know, if you have a patient that comes to you and actually you see them in fear, and actually the subsequent appointments for different reasons, some of that fear dissipates and you've got this lightness and you're seeing much more of a holistic version of someone. It's I think if it were me, I think sometimes I'd find, again, what you're saying is that compassion is key to that, because actually we know that people show up in different reasons at different points, and it's not defining of us. There's always going to be a reason as to why someone is having a tough time. But it's just, I reflect on my own breast nurses, and I wonder how. And you don't at the time, do you? Well, you know, because it's just about
moving
me.
through as best you can, aren't you?
And what you need, and your needs being met, you know, quite transactional. But actually on reflection, I go, cool, I wonder, I imagine some of that must be hard for them, because, you know, they've got, they're in the middle, you're the glue.
Yeah, you are right in the middle. I think that hopefully you are the link into all the other health professionals, but it's a person that has that kind of continuity with someone and building up a relationship with them, and then starting to unravel a little bit about what their circumstances are and what support they've got around them, what they don't, the different challenges that they're having, because life is just challenging in itself. Absolutely. Isn't it? You're already spinning plates before even this happens, and when that blows out of the water, all the consequences, you know, around, there's certain times where I feel there is quite a gap, is that when women have got young kids and needing to be able to either get to appointments or just not feeling able to be able to cope on a practical level at home, we don't really have anything much captured to help families. There is a small charity near to us that can help, but it's hard to go in and build a relationship with a child. You can't just get someone to come in and babysit they don't know. It would be nice to be able to have, that's another thing I've been thinking about. How do you create something where you can build a relationship with children, be able to help out in these difficult situations? I think those things on a practical level, because I've got grown-up kids, I've got young grandchildren. I see, if it happened to them, how do women cope with those things and those practicalities? How was it when you had your girls?
So I've a son and a daughter, but my they're now, they were 4 and 6 at the time. They were 5 and 6. But I was a single parent, and actually I probably a bit like the podcast. I like to make things when I'm working things out, when I'm learning, I like to make things. And so we wrote a book together. Actually, it's my son's narrative, and it's called The Lady with No Hair. Ooh. And so I did that as a crowdfunder, and it's something that we give to other charities and organisations off the back of the fact that I think I went to a Maggie Centre and I found a book, saying Mummy's Lump, and I was gifted it.
Yes.
And I thought, what a wonderful thing. So my kids, we created, right? We tried to go, right, what are we going through, and what can we do that's really productive and useful and helpful? In hindsight, I am fully aware that there is also a massive space to grieve and process, and you asked me how did my kids and what did I do? So I accessed support with a local hospice. Yeah. And I'd accessed support through that local hospice because at the time my biological mother was at hospice. She was poorly aged up. She was at end of life. And so already had working relationships with them. Yeah. But and I remember just looking and going, they had family play therapy. Yeah. And I said, well, let's have a go at that then. But I remember it was winter. I was in middle of chemo, like bubble hats and everything. It was an evening one, and I wanted the kids to have a separate appointment because 2 very different kids processing different things. So just sat in the waiting room waiting for them to go in, and it was the most brilliant thing that we could have done. Yes, for me as well as them, to know as a mother that I was doing something for my kids. Yeah. That wasn't me trying to sit down and have a conversation with them.
I do wonder how many people have that.
I don't know, because I don't know how. I
don't think that many people would access. I think because you had the connection. I'm so sorry about your mum. But because you could see that was there and how that would benefit your kids and be able to do that. Yep. How marvellous is that?
I know.
And gives me all these ideas now.
Yeah, but it is wonderful to have dedicated time for the kids to show up individually and at age appropriate, absolutely brilliant specialised individuals to take care of that. And you're right. I think because of not sliding doors, but situations meant that I knew of that, and that was the thing that I wanted to do. But you're right. There are so many, especially younger women, as you said, lots of younger women potentially with younger families. So there's younger women with younger children needing that support, and actually. What is there if there's nothing nationally?
I don't think there's a lot. Yeah. I think that is a real gap. And I often think, being a single mum, how did you cope when you were having your chemo and you just felt, really exhausted and unwell? How did you manage?
I don't know. I don't know. I think the same as everybody else. Yeah. Right? You just have to get on, don't you? Yeah, you put one foot in front of the other, and you figure it out as you go, and you just try and... I think it's network, isn't it? It's about the importance of. I knew I could call my breast care nurses. I knew I had very close contact, with my team, because by the time I had chemo, I'd already had. This was my second time I'd had cancer, so I had a good working relationship, and I had lots of friends and family support. Yeah. But I think it's with anything when you can't see what's in front of you, you can't see what's behind you or to the sides. You just have to put one foot in front of the other. And hold on to that plan, the plans that you talk about, that that you help, that structure, that structure of this feels never ending. Yeah, this chemo hole, I didn't cope very well at all with mine physically. So, but all of that, it feels like there's no way out. So knowing that at this point we should be done, all going well with your neutrophils and stuff. Everything should be done by this point. What happens after that? And
just going back to what you said a moment ago, I had a good relationship with my breast care nurse. But those breast care nurses, to have that connection is great, but what we really need to be able to do is to signpost to really good services.
Yes,
we don't have all the answers, but we know we're in a position very often to know what's out there, what's available, and what we can help direct to. That's the most important thing. We don't have all the answers, but we know often someone that will be able to help.
Yeah, and I think that's quite a regional thing then, isn't it? Because obviously it's going to be based on what's around in the local area for people, and then that it's part of the package, but unless you've got people like you who are driving, who are because it sounds like from this conversation you're someone that sees a gap and goes, let's look at what we can do. Which is such a gift.
I think maybe it's creative. I mean, you talk about your creativity. It's thinking, here is something, what can we do? And I think that when you start to do something, you think, gosh, I think, how could I do that? But then when it's just a small thing and then it actually has that ripple effect of helping, you think, gosh, just by doing a small thing, it's helped. And then you start to get braver with it and thinking, well, maybe we could do this or that, and it's finding like-minded people. So I think it's definitely true that if I see something that's needed, I just hate to be able to say, I'm so sorry, there's nothing we can do. I think we must be able to do something. And just finding that and setting something up. And when I hear about the gap with children, I think that's something that's just nationally we don't pay enough attention.
No, we don't. And then there will be different people cope depending on cultural differences. Different people talk about things or deal with things differently. The other thing my kids had play therapy, but they also had these like weekly events that lots of children who were accessing the service, they could have like a movie night, or they had one where they all went out and they had farm animal, or they went to a farm or whatever, or it was a family kind of based piece. So there were these kind of drop-in sessions as well, where other kids could connect with other children that were, so I
that's the kids' side of thing. The other thing I was thinking about is quite a lot of women talk about their partners.
Yes.
How sometimes there becomes like a disconnect, or they don't really understand or feel they should be getting better by now, or feeling differently. Also part of sexuality, part of getting back to some type of relationship when it may have been off the menu for a long time for all sorts of reasons. And we've talked about that and how difficult it is to get guys to kind of interact in that way. Women are good at having a cup of tea, a biscuit, chatting it out. It's like the caveman, isn't it? The man sits against the wall with his club thinking, and the women are out there stirring the pot and chatting it all out, aren't they? And just trying to work out how we can engage, because I think a lot of guys out there do struggle, but they don't bring it up at the pub. They don't chat about things. They're quite isolated as well. And I think if they could understand more, that would help couples, if they're in that situation. That's something that we've been thinking about quite a bit recently.
And it's such an important part, because men are impacted by breast cancer as well, and that's a whole different piece. But I think you're right, that caregiver piece, creating a space for openness and vulnerability and connection, to go, me too. Now we can talk openly about this. I totally agree.
And with men with breast cancer, I think that's quite a difficult thing. It's not something that it's easy to say, to the guys, to the mates, so I've got breast cancer. I think that's...
Have you had many men obviously go through, your care as a breast care nurse? Have you?
Very few.
Okay.
Very few, because it is such a minority, such a low percentage of men. And I think when that does happen, we do have resources, and I feel a bit better equipped now than I did when I very first started. And it's different. Often the way they deal with it is different. Talking, sharing that, with their loved ones. But I can't draw a lot of experience because I have little experience on that. But it's something that
I think the more
we want to navigate through as best we can.
And the more conversations we can have about it. And I know there are some brilliant charities starting to kind of, really form and grow about raising awareness and advocacy of the importance of understanding that this is something that is not just a female, predominantly, yes, it is a female-based disease.
We see kind of what's called gynecomastia, which is an overgrowth of male tissue.
Okay.
And so we see that quite a lot in clinic, that men come in, they're very self-conscious about, and that can be a worry that they've got cancer. That's quite common. It's always good to get checked out, because you can have that unilaterally, just one side, both sides. And so I think men are quite fearful of coming forward. But I think the majority of times when they come, it doesn't turn out to be a breast cancer. But it's always good not to ignore those things, but just to get checked out in that way.
Yeah, and I'm going off on a tangent a little bit here, I suppose, but I wonder how many men actually do come, because actually to call up and go, I need to go to the breast clinic to get something checked, you know, you'd hope that, that was probably a referral from a GP, possibly?
Yeah, usually referral from a GP, but I think they'll often just suffer with it for a long time and feel embarrassed about it and camouflage, wear different things. But I think it's usually when the summer comes and the tops come off and they're thinking, I can feel something, and now you can really see it. It's normally a referral from a GP usually.
Yeah. Okay. Charlayne, I'm really interested. Is there anything in terms of advice you could give people, when little nuggets of wisdom, like what to think about? I went in alone on some of mine, and sometimes I think, I wish I'd taken somebody else to take notes, but I ended up, scribbling bits on a piece of paper and stuff. But based on your experience, are there any things that would help someone in that room?
I think personally, as a breast care nurse, what I think is important is that you can get that person from the waiting room, so that they know that you're going to be in the room with them. Introduce yourself, because sometimes it's really off-putting to go into a room where there's other people in a room and you can feel quite overwhelmed. So it's introducing yourself, say, I'm here to support you today. And if at any point of time you want to stop, just look at me and just put your hand up and we'll stop and we'll take that time. Because I think to go in knowing that you're not alone, you've got somebody in that team that is there for you is important. So I think for any new breast care nurses, I think that's really important. And I think also when you come for that appointment, to be prepared. Think about some of the questions you might want to ask. You'll never remember them all in the appointments, because you can go quite blank. So make a list, that's absolutely fine. And more often than not, if you want to record the session, you just ask the person that you're talking to. 9 times out of 10, they'll always say yes. So if you want to be able to record that, so when you go home, you can listen to it over again, make more notes. And so no question is a silly question, and absolutely want you to ask as much as you can so that you feel empowered with all the information that you've got. But we're also really aware that you can have a lot of information overload. And so I think your breast care nurses are there on the phone to do use them and ask any more questions that you want to. If you can't answer them, we'll certainly find someone that can answer them for you. I think it's not feeling rushed and taking your time. You don't need to rush at this. We can take time to make sure you're making the right decision. That's really important.
Thank you. So notepads and clipboards.
Yeah, that's helpful. Yeah, absolutely.
I also didn't know about recording, and I think that's a great thing.
Yeah.
Right?
Most of them always say yes.
Yeah, just get your phone out, right?
Yes, get your phone out. Absolutely. Press it. Yes, you can do. I mean, I think during COVID, we had that situation where women had to come alone. So we had a partner's family in the car park, in the car. So they put their phones on so they could listen into the consultation. We had that at that time. So
that's great. Okay.
Technology is very helpful like that, isn't it?
Absolutely. Yeah, brilliant. Yeah. Thank you.
Yeah, when we talk about frustration, sometimes I think it's about bringing topics into a conversation. We reflected earlier about bringing in sexuality and vaginal health, vaginal dryness. These are things that very often are not comfortable to talk about. But what I've heard from the support groups is we don't talk about it early enough. And what they've said is, what they would campaign is, when you come earlier and you bring your partner with you, that's the time to raise it, to say, when we potentially maybe use something like an endocrine treatment like tamoxifen or an aromatase inhibitor that has effects of vaginal dryness, that's going to affect your physical relationship. And what they said is better to be able to say it when they're both present, because it opens up that topic of talking between themselves. And I think there's so much kind of going on in the early stages of information, trying to navigate where to drop it in, that it's appropriate at that time. It's maybe the last things on their mind, but sometimes it has such a lasting difficulty. And so from the focus groups that we've done, they've said, please, all breast care nurses, bring forward that topic very early, and especially when you've got a partner present, so that then that becomes then more of an open topic and also an understanding. And there are information you can give out as well. So I think when we have a diagnosis, I give something to the woman there, and also if there's a guy there, I give one about understanding when your partner has. And I think that has some information in there, and at least they start to think, I know that she's going to be not herself, her libido is going to be knocked straight off, she's not going to feel body confident. And I think for guys, they don't know whether they don't like to make an approach, because they might feel that seems inappropriate. If they don't make any approach, the woman will often feel they're not finding me attractive anymore, and you start to get that kind of disconnect. So I guess it's trying to work out, I know that's in my mind because women tell me that really, really strongly, but it's actually trying to work out how and when to do that.
I can't imagine how easy that is, because obviously, you know, you're having an organic conversation, and then you go, sex.
Yes, I know.
It is vital, but I don't know how you naturally weave that in.
I find the time that, if anything, when women come for their post-op results, and then potentially if they are then not going to go on for chemotherapy, but we talk about an endocrine treatment, and I would then say, is it worth just talking about those kind of side effects? And maybe the surgeons or the guys particularly might say, oh, you might feel a few hot flushes. But I then said, but also has quite other impacts, something to be mindful of. It may well affect your libido and some of your intimacy. And then they say, oh, okay. And then we'll kind of just leave that. That's quite a good time, because we've actually launched the topic there, and it's getting the right information out at the right time. A little bit more difficult then when you're navigating through chemotherapy, and you've got chemotherapy and possibly biological treatments, radiotherapy. Yeah. Where do we bring that in? So we're always working on those things. I suppose it's getting to know your patients, and sometimes I say, bring him to your next appointment, and when we're chatting, I'll bring that in. I think it's just trying to just navigate that, isn't it? And the best we can.
A unique level of skill needed to build that rapport quite quickly. Yeah. Trust quite quickly.
It's a bit like a strange form of speed dating, isn't it? Just trying to just work out very quickly where someone is coming from and where to aim things.
You're my hero.
Oh, not at all. No, not at all.
What you stand for and what you're doing for people, and the betterment that this kind of this innate part of you that wants to do better in a situation, find a gap and go, right, how can we help and empower those around you? Yes. What a life. Like that's
it is. I can only but say to you, it's a total privilege. It makes me feel quite tearful because it's a privilege.
Yeah, I get that. I get honestly the impact you have. Oh God, we're sorry.
We're starting each other off now.
Do you know what? It's such on behalf of all patients around the world, not on behalf of all of us, but I genuinely thank you for the work that you do, the care that you give, the time that you sacrifice, and thank you.
And I'd like to say on behalf of all the breast care nurses, thank you for sharing some of the most difficult and challenging times of your lives and letting us in. That is a privilege.
Charlayne, thank you so much for your time today. And it's been brilliant. Thank you.
Oh, thank you very much for having me.
Cups and Courage shares honest, personal stories of people affected by breast cancer. The views you hear are those of the guests and host and don't replace medical advice. If you're concerned about your health, please speak to a doctor or healthcare team. Cups and Courage, the podcast.